Hi, everyone. Today we're going to be talking about AI ethics in healthcare and medicine. I'm Zoya.
Hi, I'm Lizzie.
Hi, Ankush.
Yeah, Mia.
Awesome. So the first thing we're going to talk about is what is artificial intelligence or AI? AI refers to a set of technologies that is used to mimic human judgment. It's applied in multiple patterns of technology and it can be used to make predictions about the future. Some examples that you may have heard of that are AI-based algorithms are the Netflix recommendation engine, TikTok algorithms, or Instagram's sorting algorithms. The definition of an algorithm is a procedure or a set of steps executed by a machine to achieve a certain goal. And whether or not we recognize that these algorithms are governing our lives and they're implemented daily into all our actions. So how does AI work? AI algorithms are used in many different factors. So one of the examples is used to make an estimation of the value of a house. So based on different factors like the number of square feet, the number of bathrooms, the rating for the school nearby, algorithms look at these different factors like a training data set and uses these examples and the information from these to generate like a house price based on the different factors provided. And algorithms use complex math to approximate how much each of these factors influences like the final house price. So essentially together it puts together a formula. Algorithms apply formulas to a testing data set. So other houses where we all have that information, so all the information is stored, it's used to test its predictive ability. So what is the role of AI in healthcare? One of the main examples of AI's prominent use in healthcare is Viz.ai stroke detection. So this is a new machine learning powered stroke detection technology. It's used to synchronize stroke care and reduce systemic delays between patients and their treatments if they're prone to having a stroke or about to have a stroke. So it increases efficiency as someone can, identify the different symptoms and feelings that they may have through an app, which is used through AI technology to recognize, the different, factors that might lead to someone having a stroke. And on average, patients went from being very bedridden and needing a lot of support, nursing care 24/7, to walking out of the hospital without any assistance with new AI diagnostic speed technology.
So, how can AI make healthcare less expensive? As healthcare costs rise, a driving force behind AI is its cost efficiency in medicine. For example, Athelis utilizes machine learning and computer vision to identify morphology and rapidly characterize cell types from a tiny finger prick of blood. The CEO of Athelis, Tanay Tandon, explains clinicians and health plans are able to save thousands of dollars annually per patient by reducing hospitalizations, detecting adverse events earlier from frequent Athelis tests, and by keeping patients safely compliant on necessary therapeutics. The technology used by thousands of patients around the country every day, including those on aggressive anti-cancer chemotherapy, on immunosuppressive antipsychotics, and on inflammatory drugs. Beyond saving money, Athelis enables chemotherapy patients to get important results from the comfort of their own homes, reducing the strain and risk, especially during the pandemic from hospital visits. So the next question is, what factors should be considered in how and where AI is used? How do these factors apply to its use in medicine and healthcare? So some important factors to consider are privacy and protection in accordance to HIPAA, also data analytics and risks with genetic modification, empathy towards patients, and racism/discrimination and encoded in AI models. So how does bias enter healthcare AI? So let's take a look at racism in healthcare. Black people's nerve endings are less sensitive than white people's. Black people's skin is thicker than white people's. Black people's blood coagulates more quickly than white people's. According to AAMC, half of all surveyed medical students believe one or more of those false statements. Black patients are suffering is underestimated due to their perceived higher pain tolerance, and Black patients are 22% less likely to receive pain medication. So, what exactly is artificial intelligence? Techopedia defines AI as a branch of computer science that aims to imbue software with the ability to analyze its environment using their predetermined rules and search algorithms, or pattern recognizing machine learning models, and then make decisions based on those analyses. AI has incredible computing power, can process large sets of data, and discern patterns that we can't. Machine learning algorithms can take new training data, learn, and improve predictions.
So here's an example of a case study that was done about racial bias in healthcare algorithms. So what it proved is that the algorithm is less likely to refer Black people and white people who are equally sick to programs for patients with complex medical needs. And this algorithm is actually being used by hospitals and insurers for approximately 200 million people in the US. And it also gave Black patients who were more sick the same risk score as white people. And in continuation of this case study, under the algorithm, Black patients classified as very high risk had about 26% more chronic conditions than white patients rated very high risk. And according to Senthil Mullainathan, who is a professor at the University of Chicago, instead of being trained to find the sickest in a physiological sense, it ended up being trained to find the sickest in the sense of those whom we spend the most money on. And there are systemic racial differences in who we spend money on. And if racial disparities were corrected, researchers found that the number of Black patients recommended for the program would have nearly tripled.
And another case study with the COVID-19 vaccine distribution algorithm, the medical racism has created permanent distrust in communities of color. And so people have found through surveys that Black people have low confidence in vaccines and their efficacy. And so people in the medical field are asking if this could lead to higher COVID-19 mortality rates in at-risk low-income areas. And algorithmic bias could drive lower trust levels. Moving on to another case study with the bias in Alzheimer's speech detection models. So models trained to diagnose Alzheimer's from someone's manner of speaking. And so it was developed by Canadian researchers at a Toronto-based company. And it only trained on English speakers with a Canadian accent and who spoke in a regional dialect, because that's all of the test subjects they kind of had access to train this algorithm. And so the consequences were that the algorithm was inaccurate for those with foreign accents. People, and this also includes people with a tic, a pause, or grammatical inconsistencies. And those people were mistaken to be at risk or to show symptoms of Alzheimer's. And so this could have ramifications for immigrant communities who have different accents, or people not from the region who speak with different dialects. And so then that is why people in the US, like Senator Cory Booker and Senator Ron Wyden, urge the federal government and major insurers to combat racial bias in healthcare data algorithms. And they say in healthcare, there is great promise in using algorithms to sort patients and target care to those most in need. However, these systems are not immune to the problem of bias. And they wrote that in a letter. And AI shows a lot of promise in healthcare, but we need better design and regulation. And so that's why these senators are kind of urging action from the federal government. And that's all we have for you guys. But please get involved with Encode Justice by checking out our Instagram and TikTok at Encode Justice. And you can check out our Medium publication at medium.com/encodejustice. And you can apply for a fellowship or contribute to our Medium publication. Thank you guys so much.
Thank you. Stop recording.